Finally, another sad story.
Cool.
Yeah, I know, right? Well, I mean, these things are important because when things like this happen, it's always interesting to talk about them because ultimately, educated people could potentially save themselves or someone else. So
Agreed.
That's why we talk about them. Have you guys ever heard of this Brazilian celebrity, Luana Andrade?
No. I have not.
I hadn't heard of her either. I mean, you may have because she is pretty big on social media.
What does she look like?
So, yeah, we'll still up that title thing.
Well, funny you say that.
Funny you say that. That picture was actually taken on Sunday, right there.
And
wow.
is she dead? Oh,
Yeah.
she's dead.
Yeah, she died.
Good Lord.
So this story is pretty crazy.
She fit.
Yeah, that's part of why the story is crazy. Like, you guys, I want to hear what you guys think about this. So Luana was a 29-year-old Brazilian model, reality TV star, influencer. She had her own clothing line. I mean, this girl was like on top. She's really big on Instagram. I think she had like 500,000 followers on Instagram, so she's pretty legit. So Monday, so just 4 days ago, she died from complications of plastic surgery. Now, this is where the story gets really odd. So the hospital reported that she was having liposuction of the knee. And now, I've done liposuction of the knee, okay? It's not common, but occasionally people will have these kind of unusual fat pads around the knee. And
I was like looking at my knee.
Yeah, I know, Sarah. Sarah's looking at herself.
My knee's fat.
Sometimes patients will have this kind of unusual fat collection, usually kind of on the inside, right above the knee.
Okay, yeah, I think I know what you're talking about.
And I have done liposuction of the knee a few times, like maybe 2 or 3, not something we get a lot of. And I've done tons of liposuction, so it's not like I don't do liposuction, I do. It's just I've just only done a few of these. But the confusing part is, well, there's a lot of confusing parts. So first off, the hospital reported that the patient suffered a respiratory event 2.5 hours into the surgery. Now, the last time I did liposuction of the knee, which actually was not that long ago, it was this year, it was a few months ago, I think I was done in 30 minutes.
Yeah, I was like, that's a really small area, 2.5 hours.
It's a tiny area. I mean, liposuction does not take long, even in larger areas.
Yeah.
Usually what takes the longest with liposuction is repositioning. Because like say you want to do your hip, like you have to put them on their side, do one side liposuction, then flip them over, and then do the other side. And it takes time to do that. The actual liposuction doesn't take that long.
Right.
I mean, it's pretty quick. So 2.5 hours into a liposuction of the knee makes 0 sense. That makes no sense. They said that she suffered from a massive thrombosis. One article said massive thrombosis. The other said she had a pulmonary embolus. So have we talked about PE, pulmonary embolus here? Maybe once? I don't know. All right, so
I don't know.
Pulmonary embolus is when you get a blood clot in your veins and then it goes to your heart and then through your heart to your lungs. But what happens is it goes to the lungs, the blood vessels go from really big to really small. And so the clot blocks the blood flow to the lungs, which then stops oxygenation, and then you die.
Right.
And it's very, you don't always die from PE. In fact, my father-in-law had a PE, and it hit him pretty hard, and he got sick, but he survived, and he's more or less fine from it.
Okay.
So they are survivable, but it's just odd. When you talk about pulmonary embolism and surgery, it's generally something that happens after the fact. It is a risk to develop clots from being in surgery because you're immobile. Sometimes the surgeries themselves, especially orthopedic surgeries, can injure veins, which then cause a clot. And then a few days later, the clot breaks loose and it gets into your lungs and you have a PE. Now, normally, when people have PEs, they're usually small clots and it causes them pain. They go to the hospital and they get treatment and they get better.
Okay.
For her to have a massive pulmonary embolism during surgery just literally makes no sense. Like, it just doesn't make sense. I mean, in order for that to happen, you almost would have to think that they injured some big vein, which then started clotting, which then showered the clots into her lung. I mean, I guess that's possible, but it just doesn't jive with the story. I'm not really sure what happened to this poor girl because the story doesn't make any sense. And so I question if she had a pulmonary embolism. The other thing, as soon as I saw the story, I was like, she had a BBL. And I was like, the thrombosis is fat embolism. Because there is a little bit of a language, not barrier, but like the Brazilian hospitals are reporting, in Portuguese, and then there's this translation. And so I wonder if in the translation, they're confusing fat embolus with pulmonary embolus, because that story makes sense that, she could have died suddenly from, I mean, we've done, how many stories have we done about people dying from fat embolus and from BBL? I mean, in the last year, we've done several,
Yeah.
And so I wonder if it's that. It also would make sense too, because if they were doing 2.5 hours of surgery to get fat to do BBL, that makes sense, right? Instead of just liposuction and knee.
Yeah, that's weird.
Yeah, it's weird, and I don't have all the story. Another thing too, I want to show the pictures of this girl. If this girl came into me and wanted liposuction, I'd send her packing. I mean, this girl doesn't have any fat on her. I mean, look how fit she is.
Yeah.
The whole story, look, I do this one because it had her knee. I pulled these off her Insta.
She's got some fat knees.
You think she has fat knees?
No.
Oh, okay. I was about to say, I need to get glasses.
That's like the weirdest thing for somebody to comment on anyways.
I know. I just don't know, I feel bad for this girl, because if that girl came to me and wanted liposuction, I would tell her no. Like, there's just not enough to liposuction on her. Like, it'd be unsafe, and not like death unsafe, but that she would scar because you were taking out too much fat.
Yeah.
And so, yeah, I don't know what happened in this situation, but I feel bad for her, and I don't think she was married, but she had a boyfriend, and I can't even really comment on how to protect people because the story doesn't make sense. The one thing I would say about this is, if you look that great and you're looking for plastic surgery, I mean, you have to question a surgeon that would agree to that. Somebody who would agree to do surgery on her, I think, is questionable as a surgeon. I mean, especially lipos. Yeah, I mean, that's just, it's them doing something for money and not because it's safe or right. I mean, look at her. She's got like an 8-pack.
I know.
I mean, where is the fat on her? She has no fat.
On her knees, apparently.
I guess, but I don't think that that's right. I mean, because 2.5 hours, 2.5 hours is just an unheard of time to do liposuction, unless you were lipoing. Like, maybe if they lipoed her entire leg. I mean, she looks muscular. Her legs look kind of big, but it's because she looks muscular.
Yeah, she has some thick thighs, but those are definitely because
there's like a whole...
works out.
Most of her Insta is like her at the gym. Well, not most of it, but there's a lot. Like her doing squats and deadlifts. I mean, her legs are big because she's like...
Yeah, because she's got muscles.
She's muscly, yeah.
Real quick, too, Dr. Hermann, going back to her earlier story.
Yeah.
Cindy Herman, she commented, we are blessed to witness some of the miracles of modern medicine. Also, the OR team that consisted of 140 physicians, nurses, and other healthcare staff.
Oh, wow, for that face.
For the face transplant.
Yeah. It would be something crazy like that, to do a case that big. I mean, you'd have just countless doctors, and then all the pre-op team, the post-op team. There's a transplant team involved, because of the transplant medications they have to take. Yeah, I could totally see that being an enormous team. Yeah, pretty cool story. But
yes, indeed. All
right, well, I don't know what to say about poor Miss Luana Andrade. It's super sad. I hope that they get to the bottom of this, and I don't know if someone's going to be held responsible for this or not. I mean, it's certainly a questionable story and as to what happened to her, and potentially something may have been done that shouldn't have. But I guess hopefully time will tell.
Yeah, that one's strange. I think that's the strangest lipo situation I've heard.
Yeah.
Or just plastic surgery.
There's something odd going on there.
Yeah. So. Weird.
All right, I think about that's all the time we have for today. Thank you guys so much for tuning in. Please leave us a comment and let us know what you want us to talk about, and we'll see you on the next episode of Nip Talk.